Hello everyone, in this video we will discuss about pregnancy tests. So there are various methods by which the person can confirm the pregnancy. It is firstly the serum beta HCG level, then urine beta HCG level. Now beta HCG, it comes slightly earlier in the case of serum, around 3 weeks after your LMP, and in the urine around 5 weeks after the LMP. Another method which can be used is the radiological investigation, that is the ultrasound. In the ultrasound, the radiologist will visualize the gestational sac being formed, and this can be done either transvaginally or transabdominally. The transvaginal route is used earlier in pregnancy, and transabdominal used slightly later in the pregnancy. Now going to we will firstly discuss the HCG. What is HCG and how HCG is its role in pregnancy. Now HCG is actually a glycoprotein hormone which is produced by placenta, and it circulates in the maternal blood, and then it is intactly excreted by the kidneys, and therefore it comes in the urine where we can detect it. And it has two subunits. There is a alpha subunit and there is a beta subunit. You must have heard we always do beta HCG, not alpha HCG. Why? Because HCG is very much related to some hormones such as luteinizing hormone, FSH, your TSH, and especially the alpha subunit is very much related to these hormones. So alpha subunit of the LH, FSH and TSH resembles that of the alpha subunit of the HCG. However, the beta HCG is different. It has different immunological properties to it. Okay, so therefore we always use beta HCG. And antibodies are always used against the beta subunit of the HCG so that there is no cross reactivity. Now going to what produces HCG. So HCG is produced by syncytial trophoblastic cells and the placenta. However, after 7 to 10 weeks of gestation, that is around first trimester, the progesterone is sufficiently produced by the placenta, and therefore the HCG level will decline. Okay, so HCG level is mostly higher in the first trimester, and then it falls down. Now going to the clinical indications of doing HCG level. Okay, first and foremost, very important, and it is the early diagnosis of the pregnancy that we can do either by the serum or by the urine HCG test. Routinely, urine HCG test is performed at home only by the person, so this is the most convenient option. Then second is the early diagnosis of ectopic pregnancy. Now always the pregnancy does not happen in the uterus, it can happen in the ectopic locations like fallopian tube. So in this case, to diagnose it early, also HCG level is monitored in the person. So here we go for transvaginal ultrasound, and secondly quantitative estimation. Now here you should know it is the quantitative estimation of HCG which is done if a person has any history. In that case only quantitative estimation of HCG is done. So normally in normal intrauterine pregnancy, the HCG titer will double until the first 40 days of gestation. Okay, but if this rise is very slow, then we can think that either it is ectopic pregnancy or it is kind of a missed abortion. So this is the one role of HCG. Second, to diagnose and follow up the gestational trophoblastic diseases. Now there are many gestational trophoblastic diseases. In this also HCG level is done. Okay, here the HCG level will rise and rise only. Okay, it will be very high in case of gestational trophoblastic disease, and also after, to follow up the choriocarcinoma patients also, the HCG level is monitored every 3 months also. So this is another indication to do beta HCG. And last one in the pregnancy is your maternal triple test screen. Now this triple test screen is done to check for Down syndrome or neural tube defects. It's a screening test which is done. So in this we use, as the name suggests, they are triple test. So the triple markers are used. First we check the beta HCG levels, then alpha fetoprotein levels, and unconjugated estriol levels. And this is specifically done within few weeks, like around 14 to 19 weeks of the gestation. This is also very important because the levels will change according to the gestation. So this is also here where the beta HCG is used. Now going to what are the methods which are used. First is the bioassay. Now bioassay routine nowadays is not being used. It is totally being replaced by the immunological assays. Uh, Here the beta HCG from the serum of the person who to be tested was injected into the laboratory animals. So therefore these are not used today. Second is the immunoassays. These are very rapidly used, and these are very sensitive tests for detection and quantitation of the beta HCG level. So various tests which can be used are agglutination inhibition assay, ELISA, radioimmunoassay, and immunoradiometric assay. Now, most commonly used technique is the agglutination inhibition assay. Okay, these are more sensitive tests, but the most convenient one and the most commonly used, especially in the urine strips, which is provided in the market. So that is the agglutination inhibition assay. So here you can see this is a very it's a kind of a qualitative urine test, and here the person is asked to pee inside this little you can see hole over here or a strip over here, and then the test is like a rapid card test. It is automatically it gives you the result. Here the person is told to use early morning urine specimen because this contains highest concentration of your HCG levels. And there are two, here you can see there are two lines. There is one test line and then one control line. Firstly, the control line should come positive in each and every test which is performed, and if the tests come positive, then the test is pregnant, otherwise it's not pregnant. So this is the thing. So here you can understand better about the procedure what is done. So here the urine is placed, and then there are two lines, which is first is test and second is control. Now in the urine, if beta HCG is present, so beta HCG in the urine, and how in this line in agglutination assay is antibodies to your beta HCG. So if it is present, what will happen is the urine contains your beta HCG, and here the antibodies are present against beta HCG, and when it contacts with this, then there are numerous multiplication of these reaction which is happening, and this will give you the test to be positive, and a control is coming positive always. Okay, so now going to the latex agglutination test. This is the second test. Okay, in latex agglutination test, something is different than the regular agglutination assays. So what happens here is, here there are some particles which are coated with your HCG. Okay, in this anti-HCG antibodies and urine sample is there. So what happens is, here if no agglutination occurs, okay, because these will not be agglutinated if there is HCG present. So if HCG is present in the urine, it will bind to the anti-HCG antibodies, and then the particles which were coated by HCG will not agglutinate, and if they don't agglutinate, it will give a positive test. It is slightly more sensitive, this latex agglutination test. Second, if the HCG is absent in the urine, there will be no binding of the HCG, and therefore these antibodies will bind to the latex particles of the which are coated with the HCG. So this is one more method which is used. Other methods which are used are ELISA. So these are more sensitive but not routinely performed. Second are the quantitative estimation, like ELISA in that. Okay, so quantitative estimation is done for some things only, especially like very early in pregnancy, estimation of accurate gestational age. Then very importantly, it is done for the ectopic pregnancy, threatened abortion, or any gestational trophoblastic diseases. So that for that quantitative estimation is done. Otherwise qualitative estimation by the urine sample is routinely done. So this was all about the pregnancy test. Do ask your queries in the comment box. Thanks for watching this video.